This is Lynn, my co-coach in many of our programs here, the weight and fat loss programs, and also the hormone and sex survival programs. As many of us female leaders, we all experience the use of birth control methods, and Lynn is gonna tell us her experience, how this whole thing impacted her life, how she decided to use birth controls, again, her thoughts about this whole subject. So Lynn, you've used birth controls in the past, right? I know because you and I talked about this so many times, right? Why don't you tell us what made you decide to go talk to your doctor about putting you on a birth control method?
Okay, I would say I never really used birth control when I was growing up. Um, so to say, I would say I just depended on condoms
Mhm.
um, until, got married and then started having um,
Sex.
unprotected sex.
Yes.
That's the word. Unprotected sex.
Okay, well, you're married, yeah?
Yeah.
Okay.
So I would say I didn't have to use birth control until I had my last baby. And the last baby, of course, was a surprise. After the second one, I wasn't gonna do it again. I was too tired. It was too much. So I wasn't gonna do it again. But it came as a surprise. Thank God, it's a gift because I got my boy. Um, but right after that, I knew that fourth child is not an option.
Yeah.
So I got to do something about it. So I saw my gynecologist and we went through all the options.
Okay.
And eventually, IUD is what kind of settled with me. So I decided to go in to get it.
But how did you guys
inserted.
decide IUD versus the patch, the ring, the injection, the pills?
Um, for some reason, I felt like the side effects for the IUD kind of was much more um, not too severe because the other word is not coming. So it was minimal to me. So I kind of like, okay, this one looks like it doesn't have too many side effects. So I would just go for that, instead of the pills, because I don't like the pills. Failed me one time. That's how I got my third child, actually.
So you
Sorry.
were on the pill?
Yes.
Okay.
Yes.
Okay.
Right after my second,
Mm-hmm.
I think 12 to 14 months ish, I decided to try the pills, and it didn't go well. It didn't go well. That was actually my first time. Now I remember my first time.
So what didn't go well with the pills? What do you mean by it did not go well?
I woke up very down spirited. Like I didn't feel right.
No motivation?
No motivation. I did not feel right. I wake up and it's like something is not right in my, and as people knows me, I I will wear my smile every day, but I knew something was wrong. So I just decided not to really take it until boom, I had the second one show up. Yeah, the third one actually show up. So after that, I was like, okay, that's it. I would choose the IUD, of course. The IUD was inserted, no issues the first month. But 3 months
Hmm.
is when somebody who's had a child, and really I was happy. I was, I was so much alive. All of a sudden, I became depressed.
On the IUD after 3 months.
Yes.
Depression settled. Okay.
Yes.
Wow.
Yes. And that's when I got the title. I never got the title postpartum depression until after I took that IUD in. 3 months after.
So what did you do?
So life became miserable.
Right.
The people who knew me, I woke up every day crying and asked me, why are you crying? I don't know, but I'm crying. Nothing was meaningful. All I'd like to do is, stay indoors. My boy was everything to me. Sometimes it doesn't make sense. Why am I looking at the same thing that brought me joy from the beginning and crying and sobbing every day? And I started having issues with my husband.
Yeah.
He became the devil that I didn't want to see.
Okay.
My enemy.
Your poor hubby, he's such a teddy bear.
I didn't just want to see him.
Right.
And he couldn't understand. So eventually, guess where we ended up?
Yeah.
At the psychotherapist office.
Yep.
We had to go through psychotherapy. Where
Couples therapy.
Yeah, right? Is it psychotherapy?
Yeah, for couples.
For couples, yes.
Yep.
And it still wouldn't go well because this woman started bringing back issues from the past that we have moved past it.
Oh God.
We came here because the diagnosis says I have postpartum depression. So let's go from that. But instead, she kept bringing the past and how we met and what the family and no. So
leave the past in the past. Okay.
Yeah. So I'm like, okay, this is not working out.
But you never thought to think it was the IUD, right? Because you had it for 3 months.
Never.
You were happy on it, and boom.
Never thought. Never thought that that was. And one thing that has not stopped is my skin.
Right.
That was when I started having acne. We'll try to clean it. We'll try to do everything, use all the products that people will recommend. Oh, use this. It will look like, oh, it's a little better, but boom, give it another 2-3 months and it comes back again.
So then what did you do?
I started having severe back pains. Severe back pains that never was there.
It's funny you said that. We saw a patient last week who has the IUD due to heavy menstrual bleeds. And that's one thing she said she started having is back pain.
Yeah.
And she has the IUD.
Yeah.
You know which one you had? Was it the copper one, Marina?
Yeah, Marina.
That's the most important. Okay.
Yeah. Marina.
Yeah. So now, did you go back to your gynecologist? Like how did you figure out it was the IUD?
Okay, so then I went to my primary doctor, and as I was talking to her, she said, okay, we're gonna do hormones, blah 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 blah. So I said, okay, let's do it.
She checked your hormones?
She checked and she said, okay, yeah, it's hormonal imbalance. Everything is everywhere.
Yep.
The numbers are not adding up, and it got to a point where it affected me cognitively, big time. I lost focus, I lost concentration. So then, I had to see the gynecologist, who up until now thinks that the IUD is the best one, and did a test, and the test he did, meaning that I am perimenopause.
Yeah, premenopause.
Premenopause, yeah. So least chance I will get pregnant. So now I am left to now figure out the natural way to make sure that I don't end up getting pregnant at this age. And then he wants me to come back to him and tell him what my plans are, after the IUD is removed.
So you removed the IUD, didn't you? Because I remember, you have it still.
I have it because I couldn't, we were still preparing, that's when we started this journey to kind of now work on this and find a solution to this.
Yep. So then how did you overcome the issues associated with the IUD since you still have it? Like the depression, the acne, the weight gain, because I know he had some issue with weight gain and decreased libido, if we're being honest.
Yeah, I mean, the weight gain, yes. Thank you for bringing my attention to that.
You're welcome.
As funny and weird as it is, I will say clearly, I feel bad for my husband. Hopefully, he still does not understand it because he is a typical man.
Yep.
But I don't want to see him.
Okay, so this is I am so, I want to say thank you for being open, because people are not talking about this. People rather put it under the rug and just move on with life. But this is serious problem. And men, they don't understand, they don't know how our hormones can become imbalanced, can affect everything. Our lives, our relationships, our sexual drive, like everything. They don't understand because they have never been through it. And we don't know that many men that's going through it right now. So I can understand where your husband is coming from, not understanding why you used to be this loving wife, not only in and outside of the bedroom. And now he can't really understand what's going on in the bedroom. So this is a topic we need to talk to. We need to bring to awareness to, because it is happening, and people, us female, married women, like people with significant others and a partner, lovers, they feel alone. Right? They feel alone because we don't understand, the spouse doesn't understand, and other people are judging them. And it's like, it's not you. Right? Like, who would choose to have decreased libido and not having a healthy sexual appetite? It's just your hormones. So it's amazing how now more and more people are talking about it, but still some people still choose to just turn the face the other direction.
Yeah, and let me add this. Sometimes I'm like, okay, you want it, just get it and go.
Yeah.
But after he's done,
we call that duty sex.
Yeah.
This is your duty as a wife.
Yeah. After he's done, I have to leave.
Yeah.
3 days, 4 days, 1 week with inflamed. Painful.
Yeah. Vagina.
Okay.
Yeah, we can say it.
Vagina.
Yeah.
That when I'm trying to explain it to him, he doesn't understand, and I know that he will not understand.
It's
because
not his fault.
Yes, it's not his fault that he doesn't understand, but I go through this pain every time we have sex.
Yeah.
So
Painful sex. Yeah. Okay. So then where do we go from now? You still have the IUD. Here you are learning all the things that you can, being part of our team here, helping many people like you. And that's what I tell people. We are the perfect example. Like I'm going through perimenopause now. My thing is not. I don't have any of the symptoms. I don't have IUD. I mean, last time I took a birth control, I was on the patch. What's like my son is 13. Okay, 13. I gave birth to him in 2010. Last time I was on anything, I don't remember. Maybe 2007, maybe. Because I remember being off all the things. I didn't like it for like years before I decided to conceive my son. So therefore, I don't have many of the symptoms, but I am going through perimenopausal. Perimenopausal starts at the age of late 30s and 40s, and I'm like 40 something, 43. So I can see how the things that I used to do used to give me results. Like was used to be so easy for me. Now it's like a challenge, and that's why this program that's coming up is so necessary because you're going through it. You and I are navigating, learning all the things about how to help people like yourself. And also Marilyn's going through it. She's postmenopausal and she's learning, we're learning how to address hot flashes or vasomotor symptoms, we call it, in postmenopausal and perimenopausal too. Now, what did you wish you have known on you before getting the IUD inserted?
I honestly wish that I had met you. Or let me say I have embarked on this learning journey that I know now.
Yeah.
Because we have come very, very, very far. Even though I still have the IUD, I am able to do a lot of things here. We have come up with a lot of products to help kind of, decrease all the symptoms that was causing when I met Dr. GNT. She can testify. It's not that I didn't know. It's not that I do have my shy, the shy part of me, but concentration was an issue.
Yes, it was.
Brain
Oh my
fog
God.
was an issue.
Yes. Yes. And I think the reason why I created space for you and I was patient because I know your hormone was imbalanced. So I couldn't blame you. I'm like, okay, why is she not concentrating on this? Why do I have to teach Lynn how to do this 3-4 times when it's like, because I know something was going on. Like you disclose as a female, again, we have to have this kind of conversation with ourselves and also with the people that are willing to listen. I knew it wasn't you. It's just something happening to your body and you have not yet received the help, the proper help to address that something. And so many people are suffering, which is sad, very sad. We see so many people in our clinic just walking in and saying, oh my God, I'm doing this hormone replacement therapy. It sucks. I feel like I'm living in somebody else's body. My spouse doesn't understand. I used to love having sex and I used to love enjoying myself. Now I'm depressed. I just want to be bad. I don't want to be bad with anyone. And I just want to just crawl under a rock. Yeah. All right, Lynn. So let's talk about. I mean, obviously, you're gonna have this IUD removed, and I think it's because you have embraced a healthy lifestyle. That's why your symptoms have diminished.
That's right.
Right? Because you can have the IUD, but if you continued on. Okay, what is going on here? If you continued on the path you were on, then yes, you would have